the presentation of Susan is a very good description of what's happening in the Philippines. And I can tell you, Susan, you're spot on. Now, my presentation, I have a very short presentation focusing more on the framework used by the ADB in implementing its CARES program. There, can you see it?
Yes po.
Yes.
Yeah, okay. But I don't know how to make this large. There, you have this slideshow.
Yes po.
It's not there. You see, okay, successful. Anyway, sorry. Let me start with now. We all know that this COVID pandemic shook Asia to the core, and there are many. Some countries have not yet recovered, especially the Philippines, which experienced a shrinking of its GDP by almost 10% in 2020. It's a crisis like no other. But the point is, this COVID pandemic was also an opportunity for the Asian Development Bank, which was proudly parading and proclaiming its strategy 2030 for the ADB to promote its sustainability program. You see, as a backgrounder, ADB launched in 2018 is strategy 2030, guided by two UN agreements, 2015. One is the Paris Agreement on limiting global warming to 1.5 to 2.0 degrees Celsius above pre-industrial era. I think everybody knows this. The other one is the Sustainable Development Goals of 17 in all. And there's so many targets under each goal, but essentially some of the major goals are zero poverty by 2030, zero hunger, of course, good health and well-being, quality education, and for those in the trade unions, their favorite SDG is decent work and economic growth, and well, and so on. I will not go into the detail of this. Let me see. Yes. Now, overall, the ADB's strategy 2030 talks about its vision mission to achieve a prosperous, inclusive, resilient, and sustainable Asia and the Pacific, while sustaining its efforts to eradicate extreme poverty. Wonderful. But how to fulfill this vision mission? Naturally, a good starting point would be to align its lending, the bank's lending program in support of the 17 SDGs and various targets under this SDG family. And second, align with the Paris Agreement 2015, which means greening Asia Pacific, foremost of which would be the phasing out of fossil fuels across the continent. Now, with the COVID pandemic, what was the ADB's response? Well, first of all, it was the ADB's response was amazingly quick. You see, second week of March 2020, WHO declared COVID as a global pandemic. The following week, the ADB set aside $6.5 billion as special fund for COVID assistance. Then in April 2020, it expanded this into 20 billion COVID-19 active response and expenditure support, CARES. So as I mentioned by Susan. And then within April, the four most populous countries in Asia outside of China were given these CARES loans. India, Indonesia, Philippines, $1.5 billion each, and Bangladesh, $500 million. By the end of 2020, the ADB added this $9 billion access vaccination program. And then, and of course, in between, there's ADB was giving some grants and technical assistance for food aid, procurement of some health materials, and so on. So overall, in 2020, 40% of ADB spending for DMCs, developing member countries, for 2020 went to COVID-related program. Now, what are CARES loans? They are a deviation from the usual loans. These are not project loans. These general budgetary support or supplement, and mainly to for the following purposes: to have the governments in this containment program of the COVID, mainly health-related, social amelioration to the vulnerables, assistance to failing industries, especially micro, small, medium enterprises, stabilization of the financial system. Now, can anybody be against the above? I don't think so. Now, the difficult question is, the difficult question, are they aligned with the strategy 2030, particularly SDGs? Now, this brings me to the second observation. The point is, up to now, I still have difficulty looking for ADB document or guidelines on how to align this CARES lending with the SDGs. Even on alignment with the Paris Agreement, I think NGO Forum has published a number of articles questioning the failure of ADB to make ADB align with energy transformation program in order to meet the Paris Agreement goals. So what did the ADB do in relation to the early CARES applicants like the Philippines? Well, it simply accepted the Philippine loan application without using clear SDG lenses. And this loan, this a very thick document, supplemented by ADB's staff work. Some of the ADB staff are providing supplementary analysis and recommendation, usually positive in favor of the borrowing country. Now, one problem I realized while reviewing this document is that most of the ADB staff, and probably the ADB official dome itself, is really not fully oriented to the SDGs and Paris alignment. Now, one indication of non-alignment is that there are no clear tools yet for SDG alignment. What was happening was SDG is in the business of tagging some activities or some project as SDG aligned. It's just SDG tagging. Just like here in the Philippines, the Department of Budget and Management would tag almost half of the expenditures of the Philippines as climate change aligned, or aligned with with this climate change mitigation or adaptation, more than half. So SDG tagging without any clear and measurable indications that these projects are indeed aligned with SDGs. There were also no indication that ADB has undertaken an overhaul of its traditional tools in assessing projects. Briefly, you have at the micro level the cost-benefit analysis. If you are in economics, one of the book that they share with you is this old Litton Merlis method, popular with the World Bank, focusing on internal rates of return. The problem with this method is overly focused on benefits and that accrue to the government as the initiator of the project, and to the private investor developer of the selected developer of the project, neglecting usually the broad social, economic, and environmental impact of the project. Some examples: ADB's approval of big dams without considering the social and environmental cost of this big dam, and then but they will put in the report high IRR for the ADB, the borrowing government, and the developers. And then at the macro level, so this micro level assessment or analysis is paired with the macro level policy formulation. And Susan already discussed this. Usually they end up with this neoliberal program favoring privatization, deregulation, and liberalization of the economy. So, and that's what in general is happening. I would like to see the day that they will overhaul this kind of project and program assessment and this approval system. So what's happening is that the traditional ADB assessment, this micro macro, you have this the ADB also came up with the 6 criteria in order for a borrowing country to merit the approval for their CARES loan application. There are 6 points. Number 1, to address adverse impact of COVID on economy. I think there's no debate. It's really a given reality. Second, to support counter-cyclical development expenditures. So some kind of a stimulus. So again, this is not debatable. That's really needed by most countries in crisis. But the third, it says there, the borrowing country must have good macroeconomic management system before COVID. And then most of those 4 countries I mentioned and the other countries that followed them in 2020, they were all given good marks by the ADB. But this is highly questionable. It depends on what do they mean by good macroeconomic management. In the case of the Philippines, the Freedom from Debt Coalition and other civil societies are questioning the claim of the government that the economy was doing well. In fact, in 2018, no less than the President Duterte said the economy was in the doldrum. But what he failed to mention is that the structure of the economy are bad. The term that we use is the economy is maldeveloped. Now, the fourth criterion, borrowing countries implementing structural reforms. And in this instance, they are referring in particular to the health reform. Again, this is questionable, and I think the discussion of Susan is right. But and in the case of the Philippines, you have a system of very bad health governance, and so 2 years after the outbreak of COVID, there's so many debates in the Philippines on how badly managed the health sector is. And then the fifth one, there's a at the last usually at the last page of the application, they discuss this debt sustainability of the borrower country, and in most cases, ADB claims that the level of debt is sustainable, and that there's no danger of default. They came up with very optimistic forecasts. But in the case of the Philippines, they said it's very sustainable, and yet in 2019, our debt to GDP ratio is 39%. Today, we're now almost to 65%. And you see the threshold warning is 60%. And I am afraid probably some other borrowing countries are in a similar situation. In other words, there was really no in-depth analysis of how of the capacity of a borrowing country to make their economy sustainable, including sustainable in terms of fiscal situation. And the last criterion is acceptance by the borrowing country of coordination with their friend International Monetary Fund. Why? I think you can guess the reasons, but the question is, why with the IMF? Why not alignment with the, for example, with the Economic Commission on the ESCAP, Economic Social Commission for Asia Pacific, which is monitoring SDGs. Of course, you can guess it's to ensure alignment with the neoliberal framework being pursued by these international financial institutions. Now, example of misalignment. One of the document attached to the Philippine application is a document prepared by one ADB staff, probably trying to project himself or herself as an health expert. And they came up with a so-called problem tree, analyzing the health sector. So the root cause to them of the health problem in the Philippines, insufficient financing. And so resulting into this core problem, inadequate healthcare system. So therefore, the effects of this is widespread transmission, limited capacity to treat and diagnose, increased number of people dying, and then you have this intermediate problem, limited testing capabilities, and so on, intermediate causes of resource, insufficient laboratory consumables, limited laboratories. So in sum, the whole argument is what is really needed is simply buttress the capacity of the government to finance, to provide more funding for the health sector. Now, the point I'm making is that what is missing in this problem tree is the identification of deeper problems. And some of them, again, mentioned already by Susan. You see, they forgot to mention that our health sector is badly governed. And up to now, there are continuing debates. The latest is the procurement of needed syringes so that people will have this third booster, booster. The broken health sector, the sector is broken because of past neglect, the obsession with privatization. And so what's happening, the high cost of health service, commodification of health service, and very underdeveloped government hospitals. Neglect of health sector workers, the doctors, the nurses, the health personnel. Many of them died in 2020 because of lack of attention and because of the chaotic system last year. Corruption in the health system, particularly in the health insurance system and in the procurement of health materials, and failure to implement the Health for All program, because again, this is based on the framework of commercialization and privatization. So in conclusion, it is clear that the ADB has failed to use the COVID pandemic as an opportunity to use the SDG framework as announced or proclaimed in its 2018 Strategy 2030. Had it done so, the recovery of the borrower countries like the Philippines could have been faster and resource more equitable. Right now, the health economic crisis has only deepened inequality in these borrower countries, weakened their capacity to meet these SDG targets for 2030, and rapid debt accumulation by borrowers shows that the ADB failed to forecast the digital, failed to make a correct analysis of the debt sustainability of these countries. Of course, it cannot be denied that the assistance of the ADB has helped ease the budgetary stress of borrowing countries, but only for a while. The point, however, is that the ADB has failed to fulfill its role as a development bank, particularly in its commitment to help, in its help to build a truly prosperous, inclusive, resilient, and sustainable developing member countries. Some borrowers, like the Philippines, has in fact experienced the opposite of these goals. Thank you. Good day, everybody.